the zygomatic recess of the maxillary antrum. The lateral apex of the maxillary sinus extends into the zygomatic process of the maxilla and can reach the zygomatic bone and therefore forms the zygomatic recess. This deeply recessed is the zygomatic recess of the maxilla. Other recesses include the infraorbital recess and the alveolar recess. The zygomatic recess of the maxillary sinus is the apex of the pyramid shape pointing laterally towards the zygoma. Interestingly, this structure is not included in Terminologica Anatomica. Let's have a look. That is the maxillary antrum.
That is the maxilla, the zygomatic process, and deeper within the zygomatic recess of the maxillary antrum. Deeply recessed within, extending into the zygomatic bone, is the zygomatic recess, a difficult to access niche within the maxillary antrum.
Let's have a look at the various maxillary sinus recesses. This is the Palatine Recess. That is the Palatine Recess. This is the maxillary antrum, inferior turbinate, septum, and the Palatine Recess. This is the infraorbital recess of the maxillary sinus. Now this is the alveolar recess. Roots of the premolar molar teeth might project into it, the alveolar recess, and this projecting into the zygoma is the zygomatic recess. The various recesses: palatine recess, infraorbital recess, alveolar recess, and the zygomatic recess. The difficulty here is when there is fungus infection of the maxillary antrum, fungal debris may lodge within the zygomatic recess, quite difficult to clear and quite often resulting in residual disease and recurrence. Now we have a cut open view of the maxillary antrum and look at the maxillary ostium. Who designed this? God, universe, powerful spiritual force, whoever who designed it, botched it up, and that is a design flaw. By creating the ostium at such a high level, it is difficult for mucus secretions, infected secretions to come all the way, depending on the mucociliary clearance and wanting to get out here. Somebody who designed it botched it up. One of the design flaws of the human body. Remember earlier we used to make an opening in the inferior meatus. That is called intranasal antrostomy. Today we make an opening above the inferior turbinate, and because it is above, it is called supraterminal fenestration. And because it reverts the antrum back to normalcy, we call it functional endoscopic sinus surgery. Anyhow, come back again to the zygomatic recess. That extending into the zygoma bone is the zygomatic recess. And quite often, when there is fungal infection, debris will lodge within the recess, and quite often, if it is not adequately cleared, it will lead to residual disease and recurrence. This is a picture of the maxillary sinus extending into the zygomatic recess, these two arrows. Now, how do we clear it? Earlier, we could use a malleable probe and go inside, but today we have an instrument specifically for it. What is the instrument to clear the zygomatic recess? It is the Huizer grasping forceps. Look at how nicely it is angled so that you can go into the recess and then clear the fungal debris within that recess. That's how it is done. This will go within, look at the contour, and go into the zygomatic recess and clear it, thereby giving the patient a one-time cure. An overview of the zygomatic recess.